Hello, I'm Dr. Renzo Ginto, Chief Planetary Health Scientist of the new Sunway Center for Planetary Health in Kuala Lumpur, Malaysia, and concurrently the Director of the Planetary and Global Health Program of the St. Luke's Medical Center College of Medicine in the Philippines. I would like to thank the World Village Festival for this wonderful opportunity that you have given me to share about the powerful message of planetary health. I wish I can be with you in person in Finland, but for now, let me bring you to my country, the Philippines. Here you will see the beautiful and rich natural wonders of our more than 7,000 islands. But these lush ecosystems and the people who inhabit them are now facing enormous threats to their health because of the climate crisis and the larger planetary emergency. Here is a map of Southeast Asia, where both the Philippines and Malaysia are located. Of course, the tropical environment here is very different from freezing Finland. In this map, the redder the country is, the more vulnerable the country is to climate change. As you can see, the reddest of them all is my home country, the Philippines. It just shows the heightened vulnerability of the country to climate change and its myriad impacts. One of these recurrent impacts of climate change is extreme weather events, such as typhoons and intense flooding. This photo was taken in 2013 when Typhoon Haiyan, the strongest typhoon to ever hit land in human history, struck the central part of the Philippines, killing thousands, forcibly displacing hundreds of thousands, and affecting millions more. When these extreme events do occur, as you can see, entire communities become devastated. Roads, schools, farmlands, water systems, even healthcare infrastructure, all of them are disrupted if not destroyed. Typhoons and flooding also generate lots of disease across the population and even deaths. And there is also something unique about the Philippine experience. For the past 2 years, we have seen firsthand the confluence of two crises, the COVID-19 crisis and the climate crisis. Imagine that you are a poor Filipino who had to confront a real dilemma asking this question. On one hand, do I stay in my house to protect myself from COVID, only to have my house being inundated by intense flooding, or the roof of my house being blown away by the strong wind? On the other hand, do I move to an evacuation center to be protected from climate-related disaster, only to contract the unseen coronavirus because, as you can see in this photo, there's no social distancing in these temporary shelters to begin with? Apart from catastrophic typhoons, the Philippines is also experiencing what we call slow onset events brought about by climate change, such as sea level rise. Unfortunately, the rate of sea level rise in the Philippines is one of the fastest in the world, 5 times that of the global average. Filipinos living along the coastlines are already witnessing their houses and farmlands being swallowed by the sea, and their drinking water being intruded by seawater which is high in salt content. Worse, entire communities will eventually need to be relocated as coastal flooding continues in the future. And if we are all wishing that COVID-19 would be the last pandemic of its kind, then we must tackle the climate crisis and ensure the planet's health. A very recent study revealed that climate change, if not stopped, could drive more pandemics in the future. In this map, you will see that Southeast Asia, where the Philippines is located, is not only a climate hotspot, but also an infectious disease hotspot. If we do not get our acts together when it comes to averting the climate emergency, it is likely that more viruses like SARS-CoV-2 will be jumping from animals to human beings, spreading across populations in the future. Despite all these warning signs from typhoons, sea level rise, and pandemics, the world continues to operate business as usual. Everybody's talking about moving to the new normal. But we seem to be just returning to the old normal, which, by the way, is abnormal. As you can see in these graphs, everything is going up. Our carbon emissions, our destruction of water sources, our cutting of trees, and killing of nature. These upward trends must stop ASAP. Right now, we may still be feeling concerned about the possibility of future COVID-19 surges, that a new Omicron-like variant may suddenly emerge, causing more outbreaks around the world. But I think we should be equally, if not more worried and afraid of future, not just waves, but tsunamis of health consequences that will be brought about by climate change and biodiversity collapse. And so as a physician, I realized that we now must treat two kinds of patients. On one hand, we have the human patient, represented by this girl wearing a face mask to protect herself from COVID-19. But on the other hand, we also have the planetary patient, Mother Earth, herself wearing a face mask, not to be protected from the virus, but from massive ecological damage that we are inflicting on her through our myriad destructive activities. This is what planetary health is all about, a new kind of approach that integrates the health of people and the health of the planet, addressing the consequences of humanity's impact on planet Earth for a better future. We cannot expect to have healthy people struggling to survive on a sick planet. In improving our health, the health of the planet can no longer be ignored. Over the past 2 years, we have learned a lot about the health of our global population, how COVID-19 affected billions of people through direct infection, disability, and deaths, its indirect effects such as the mental health pandemic, other human health concerns such as obesity that were neglected by the COVIDization of healthcare systems. Meanwhile, when it comes to the health of our planet, a recent update from the Stockholm Resilience Center revealed that we have already breached 5 out of 9 identified planetary boundaries. These are limits that need to be preserved if we are to sustain life on Earth. We are not on track in terms of achieving our climate goals. During the past century, we have seen the fastest rate of extinction of creatures great and small. We have been converting our natural ecosystems into cities and other built infrastructure. We have been pumping excessive amounts of artificial phosphorus and nitrogen into the soil, disrupting their natural cycles. And we have released enormous amounts of novel entities, such as plastic, into the environment. In fact, a recent study revealed that microplastic has already penetrated the human bloodstream as well. How can we improve the health of society and preserve the planet's boundaries? Unfortunately, we cannot keep putting out fires, both metaphorically and literally, and instead we need to address the root cause of social inequality and planetary emergency. Planetary health requires economic redesign. In the same way we need PPEs, or personal protective equipment, for our health workers during this pandemic, we need a new kind of PPE, a people and planet-centered economy. One example is the donut economics model, one that respects the planet's boundaries while meeting the basic needs of humanity. Planetary health also requires mindset change on a planetary scale. This will only happen if we redesign our educational systems to align with planetary health principles and values. This is the Planetary Health Education Framework developed by the Planetary Health Alliance, which centers our interconnection within nature and emphasizes movement building, systems thinking, equity and justice, among others. Everyone, from the young to the young at heart, must be re-educated to become planetary health-oriented citizens and stewards. Since planetary health challenges are driven by a diversity of factors, a planetary health approach also requires working across disciplines and sectors. A siloed approach is not going to work, since we are dealing with a complex web of factors, from the non-living components of our planet, such as air, water, and land, to the other living creatures, like animals and plants, as well as the social systems that drive ecosystem change, from the way we design our cities, to the way we produce our food, to the nature of our politics. And that is why in the Philippines, we established Planetary Health Philippines, a national community of scholars, practitioners, advocates, and young people who are all committed to advancing planetary health in our country. Planetary Health Philippines brings people together from a wide variety of disciplines, sectors, geographies, and generations, because we can only succeed in tackling planetary health problems not when we work alone, but when we work together. The COVID-19 pandemic may not yet be over, but there have been numerous discussions already about the post-pandemic era. My fervent hope is that on our road to recovery, we will embrace planetary health as our approach, our vision, our guide, so that at the end of this recovery process, we're able to build a future that is greener, healthier, and fairer. Planetary health is also an invitation to planetary humility. It calls us to shift away from an egological mindset that we human beings are at the top of the pyramid of nature, that we can limitlessly consume, pollute, kill, extract, and to instead shift towards a truly ecological approach wherein we are living in harmony, solidarity, greater interdependence with all creatures great and small, and the non-living components of planet Earth, our only home. Moreover, the term planetary health may sound new to you, but this powerful concept is not a novel invention. All we need to do is to return to ancient wisdom and listen to indigenous communities who have for centuries acknowledged the inextricable link between the health of people and the health of the planet. As once said by Chief Seattle, the earth does not belong to man. Man belongs to earth. Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. And finally, for me, planetary health is a call for us to become good ancestors. What we want is that 100 years from now, the children of 2122 will read the history books, will look back to the past, and they will say that the COVID and climate generation of 2022, which is all of us in this festival, were good ancestors to them because we made the right decisions, not just for our own health, but for their health and well-being as well. We are not selfish ancestors. We are good ancestors to these children and to the future children of the world who are yet to come. Let us advance the health of both people and the planet, of planetary health, together, not tomorrow, but now. Thank you very much.